Hey, good evening, Team Dyess. Welcome to our first virtual town hall of 2022. We're going to start things with opening comments from our wing commander, Colonel Joseph Kramer. So over to you, sir.
Hey, thanks, Senior Airman McGuire. Team Dyess community, Happy New Year, and thanks for joining the session, whether it's live here on the stream or if you're catching up on the video afterwards. What we want to do here is we want to just present an opportunity to get answers to you and get some feedback from you on base and local issues. We're strong in America's Lift and Strike Base. We do things here and stand shoulder to shoulder together that no one else does. Whether it's airlift or strike, we do it from one installation, and you're a big part of it. Let's kick this off with a year in review video from 2021 with highlights of the great things that our airmen have accomplished. Team Dyess, congratulations and thank you for all your hard work this year.
To the airmen and women and their families who make up this fantastic team, it's such a pleasure and honor to serve with such an amazing group of Americans. We've said it before and we'll say it again. Thank you, thank you, thank you. It is truly a pleasure and honor to serve with you.
Never forget, you're a part of an awesome team doing amazing things at America's Lift and Strike Base. Stay connected and recharge over the holidays. Together, we'll continue to fight from here in 2022. Hey team, awesome year in 2021. And on this venue in particular, thank you to the spouses and kids that made that possible. You all serve too, and that's not lost on us from the leadership team. This is a very supportive community and we can't do it without you. As we start into 2022, I'd like to just highlight a couple things going on right now across the installation, and not necessarily mission specific, but we're happy to go into those questions in the question and answer period, which will follow these comments. Currently, we're in health protection condition Bravo, And we have mandatory mask wear across the installation as of 27 December 2021. That was in response to what we foresaw coming, which was the increase in COVID cases, likely and primarily across our nation due to the Omicron variant. And so those measures are things that we can do to mitigate and still maintain the mission. And that's why we're here. What we think is within the next several weeks, we'll see the Omicron variant peak, and then we'll follow it closely. And the medical team, inclusive of public health and the entire leadership team, are closely watching the day-to-day conditions for when we adjust out of this posture. But for now, I want to thank you for taking the mitigating steps. And then let me just cover a couple more things with respect to COVID. What to do if you're sick. We'd ask you to stay away from work. We'd ask you to stay away from public places, and then seek healthcare support. And so whether that's via testing by appointment, or if you need to go see a clinician, please do that. The specifics about how to get medical care are listed on the Dyess website, but specifically you could call the appointment line as well, and we'll post that on the Facebook Live. So that's available, and you can see it real time, or you can see it afterwards on the video. The second thing I'd like you to really consider is getting boosted. I'm boosted, Chief Coltron's boosted, and quite frankly, we're protected against the variant. And it's important because the data has shown that if you're boosted, while you may still catch it, and some experts say we're all going to get COVID at one point or another as we go from pandemic to endemic. If you're boosted, it's going to be symptoms that we can handle, likely without a hospital stay. And if you have to go, then it's going to be a short one. And that's for most all of the population. So go get boosted. Let's play defense against the O. The last thing I'll talk about is, hey, if you think you might be a close contact, it depends on your vaccination status. And so we just ask you to call public health. The number to public health, 325-696-5478. That's 325-696-5478. And again, we'll post that in the Facebook Live. I want to cover one more healthcare topic, and you might have a question on this either now or in the future, but in 2022, we're going to transition here very shortly to what's called Military Health System Genesis, or you may hear it referred to as MHS Genesis, or just Genesis. And what that is that's an improvement in the electronic healthcare record system that our military treatment facility is going to use. And we all know that everything is going electronic, and that's good because as we go station from station, it'll be there. You won't have to carry it. But that's also good because this system provides enhanced security against our adversaries. And so it's an imperative that we transition to the system. The team has done months and months of work to get us to the point to go live on or about the 22nd of January. We're in close consultation with DHA in order to do that smoothly. But like any transition, there could be things that are not foreseen, and there could be things that we don't expect to happen. But what we do expect to happen is for the short period of transition, there's going to be a slight decrease in appointments available, and because of the capacity, there'll be a slight increase in wait time. And so I'm just asking for your patience as we transition. This is not like any other new capability that comes on. A little bit of a dip, but then a big increase in terms of capability and a big increase in terms of security. And so as we talk about Genesis and as we talk about transition, I'd like you to know a little bit about the why, and then ask for your patience as we do that. And again, give us your feedback. If it's not going right, there's a way that we can get to yes, but we just got to know about it in order to do that. And then finally, really, it's a healthcare concern, but it's really just a human concern. It's just overall resiliency. And so I know going into the holidays, we spend a lot of time focusing on resiliency. We use the phrase that the holidays is not a happy time for all people, but that's not just about the holidays. That's 24/7, 365. And so we say that we're shoulder to shoulder. And so being shoulder to shoulder is about getting folks help if they need it. But it's also about understanding that if you need help, that's a sign of strength, and asking for help is a sign of strength, not a sign of weakness. And so if you need some help, I just ask you to ask for it. let me just rattle off some sources that are available for you. But the most important thing is just raise your hand, send a text, make a phone call, WhatsApp, all of them will work. But we can connect you to the mental health options, such as the Military One Source, Military Family Life Consultant, the Abilene Veterans Center, Military Veterans Crisis Line, and then telemed. All of those are options which are in the pipeline, which are readily accessible. And so we're just asking for you to raise your hand if you need help, or as you're shoulder to shoulder with your teammate, if you see someone that's not having a good day, let's go eyeball to eyeball and say, hey, what's going on? And so I wanted to cover those points primarily in the medical, but really across the installation. As we talk about other things across the installation, 2 more points for you, and then we'll open it up for questions and answers. Hey, you might be seeing some great progress on the speed table on Texas Boulevard. That's right across from the youth center. I know that the one-way traffic has added time and a little bit of complexity to folks getting out and about the installation. We're in stage 2 of that project. We're going to finish it, we think, by the end of February if the weather permits. So far, so good, and they're pouring concrete today. And what that finished speed table is going to do is make sure that we have a safe environment for the youth of the installation as they transit to and from school and to the youth center. So thanks for your patience on that. But we look for estimated completion of that, mid to late February. And then finally, the visitor control center is up and running. You've already seen that, but as of 16 December, we cut the ribbon with our mayor of Abilene. And right now it's open from 0700 to 1600. It's closed on the holidays and family days, but that doesn't mean that you can't access the installation or get a pass if you need it. And so here's the steps to get a pass when the visitor center is closed. You go up and see our defender at the gate and you identify that you need a pass. And depending upon the conditions at the gate, the defender will do 1 or 2 things: either get the proper credentials and enable you to have a pass right then and there, or they'll direct you to the visitor control center parking lot. We'll meet you in the parking lot, and this is important. Please stay in the parking lot and don't cross the lanes of traffic. They'll meet you in the parking lot, and then they'll get the credentials and the pass taken care of in the visitor center parking lot. And so thanks for your patience as we got the visitor center up and going. You can see that it's a 21st century facility for 21st century airmen and 21st century Air Force. But there's a couple things we need to do in terms of passes to make sure that we still have safe and effective access to the installation. So those were a couple points that I think, 1, that we need to cover, 2, that we got some interest before the event. What I'd like to do is kick it back to Senior Airman McGuire, and we'll open up for question and answer and go from there. Thank you.
Awesome. Thank you, sir. So yeah, we're going to be moving into the question and answer portion of our live stream. We want to get your questions answered for what to expect in 2022. So we're going to start out with some general questions pre-written that we have here, that leadership, you, Colonel Kramer, or other leadership, feel free to answer if you know the answer. First, what information can you provide about childcare for those who have tested positive, are working remotely, or are in isolation?
Yeah, that's a great question. And that's an important question because, for a lot of us, we're in this business because of our future, and our future involves our kids. And so for sure, that's on the command team's mind on a daily basis. Let me give you a couple things, and then I'll pause if Colonel Jensen, our mission support group commander, has any additional comment or clarification from my assessment on where we're at. The first thing that I want you to take away is that we're going to accommodate families, and we need to do that because we're an Air Force family. And so if you're active, or if you're a spouse and you're not being accommodated right now because your primary childcare means are disrupted because of the pandemic, then we need to know about it, because the guidance is that we're going to accommodate families as we work through this. And that's operational conditions permitting. And so right now we're in an environment where we can accommodate. And so that's the expectation. That's the guidance that's been given. In terms of sources for childcare, we acknowledge that there's been disruption, and we've taken prudent steps in order to ensure overall safety. And so that's been some closure of rooms at the Child Development Center as we've come into this latest wave. Right now, we're working on a case-by-case basis for some mission critical spaces, but those are quite limited, as you can imagine, because of the staffing impacts that we've had. What there's been is routine and continuous communication with the folks that have their children at the Child Development Center to make sure that they have the latest and greatest. And we've been doing that through the command chain. What I think is the best way to do it is through the command chain, as well as direct from the Child Development Center to those patrons. And so, Colonel Jensen and his team are assessing the conditions at the Child Development Center. He and I are in routine contact. And when we can ramp up, we will do at the soonest possible measure. And so with respect to overall accommodation, if your childcare is off the installation, let's have the conversation. And then, hopefully there was a couple particulars about childcare on the installation. I'll pause if Colonel Jensen has additional comment.
Negative, sir. Perfect answer. That's right where we're at. Just know that we are evaluating every day, and we're doing that in conjunction with public health, of course, on the base, so that we're making informed medical decisions, not so much from the mission support group independently, but working hand in hand with the medical group, and certainly taking Centers for Disease Control guidance into account as well. Thank you, sir.
All right, sir. If no one else has anything, we'll get into the next question. So with the new PT tests starting this year, but COVID still being present, is there anything Airmen can expect for PT testing?
Yeah, it's a good question. I've heard it a couple times. We're in an occupation where physical fitness is important, and it's important for a couple reasons. One, it's important for our overall ability to accomplish the mission, but then there's a whole airman or a whole person portion of physical fitness that's important. And so, the PT test is just one thing that's at times a carrot for folks, and it's at times some motivation for folks, or a stick. And so, as I think about what's the purpose of the PT test, to make sure that we have a ready and capable force. Global Strike Command's motto is always ready. That applies to Dyess as the installation as we transition to fight from here after years of feeding the fight. We got to be ready. And so being ready is both physically and mentally fit. And so having that test on the calendar, I think is important. But in terms of, do we continue the test during the Omicron wave? I think we do. And that's the decision that we made as a command team. And here's why, is because you're not at any different risk of contracting COVID while you're taking your PT test, versus if we weren't dealing, versus if you were in the workplace, if that makes sense. So whether you're in the workplace, whether you're in the community, or whether you're doing the PT test, you got the same odds. And so if you're not on a profile, if you're not sick, if you've trained appropriately, and we've done the pre-screening prior to PT test execution, we're going to be just fine. And as we get warmer and warmer here, 74 and sunny today, what a good day to take a run.
Awesome. So before we get into our last pre-written question, I just want to encourage anyone watching, please comment any questions you have, Dyess specific questions, so our leadership can answer it for you. But yeah, the last pre-written question we have is there any new missions, anything to get excited about for 2022 for Team Dyess?
Yeah, I think there's plenty to be excited about. We're 13 days in to the year, and we've already executed a CONUS to CONUS mission. We had a 95% mission capable rate of our aircraft, which means 95% of the aircraft were flyable, all but one. We have less than 5% attrition for the flying hour program. That means where the standard is normally well north of that. That means that when we step to an airplane, we're going to fly. Our medical group is shouldering an incredible burden right now with the surge, and they're transitioning into a new healthcare system, and they're doing inspection preparation, and they're caring for our families day to day. Our mission support group has several projects that they're closing out, to include new dormitories for our airmen, to include installation roads. Our military affairs committee just achieved $750,000 grant for base network infrastructure enhancement, which is going to lead us into the future mission here at Team Dyess, as well as improve quality of life for today. And man, I mean, that's just in the first 13 days. So that's pretty big, a lot to be excited about. You know, in the next quarter, what we're going to do from the 7th Bomb Wing perspective is we're focused on ensuring that we're ready to fight. We're focused on enabling leadership skills to get to our frontline supervisors. And then we want to complete a community needs assessment. And so I'll just focus on 2 of those. I won't focus on the prep for fight. This is sort of an installation focused event, but what we want to do is we want to make sure that leadership skills are out to those that need them. And the approach that we're going to take for this is really a weekly 3 to 5 minute video from professionals across the team to make sure that we can make the day by day for our airmen and their families better. And to be honest, you know, depending upon what AFSC you're in, and depending upon how long you've been in the United States Air Force, you may have very little education and training as compared to some others. And so what we want to try to do is level it and get things in digestible slices out to folks every 3 to 5 minutes. And so that's what the enable leadership skills is. And so you're going to see that. And so I'd ask those that are in the broader community, ask your spouse, ask your loved one when they come home, what did they learn this week from the leadership skills lesson? Because that's going to make us better, you know, just as Americans and as humans. And then the other thing that I'll cover that we're getting after in the first quarter before we meet again is a community needs assessment. And so it's going to be important for those that have tuned into this thread to make sure that your voice is heard when that assessment comes out. We're in the final stages of getting approval and building up the survey, but the survey is going to go. And so it's important for us, it's important for the installation, support for the 7th Bomb Wing and the 7th Mission Support Group in order to know what services are valued, what services are missing, and what services can we modify, truncate, or eliminate in order to focus on what matters to our community. Again, it's about 21st century airmen and a 21st century Air Force. And so I want to foot stomp, if you can, please make your voice heard when we do the community needs assessment. I think as I kick it back to you, Senior McGuire, I think those are sort of the focal points, you know, for me in this forum before we talk again next quarter.
Great, sir. So just kind of to go right off of what you were just talking about, the 21st century airmen, I'm curious as a Dyess airman, what can I do to focus on this year to kind of meet and exceed leadership expectations?
Okay. Is this is you or this is your friend or someone?
Not me specifically, sir, just any,
Okay.
you know, any Dyess airman.
Okay. Okay, good. So hey, you know, the first thing I'll tell you, and I'll give a couple things, and I'm going to kick it over to our Command Chief Coltrane. So number one, live in the moment and be good at where you're at. Live in the moment and be good at where you're at. Oftentimes, I think it's easy to think about where I'm going to be at 10, 20 years from now. It's important to dream, but it's important to also live in the moment and be good at where you're at. And so be the best at whatever position you're at. And then you can build from there. Number two, you got to take care of yourself physically. So if you don't take care of yourself physically, you're going to run out of track. You're going to run out of runway, whatever analogy that you want to use. You got to take care of yourself physically. So that means sleeping right, eating right. All of those things are important. And then number three is kind of ironic because number one, I told you be good at where you're at. Number two, I told you to take care of yourself physically. Number three, I do think you got to have a goal about where you want to be. And then where you want to be, you start to shape number one and number two to get to number three. but the where you want to be needs to be a goal that you talk about with someone else. It needs to be a goal that you're serious about, and it needs to be a goal that you write down a path on how to get there. And I think if you're doing the best you can every day, I think if you're taking care of yourself physically, and then if you're looking forward to achieving that next step, whether it's you want to fly the night one sortie, whether it's you want to be on call when an airman needs you, whether it's you want to go do something else in the United States Air Force, that's okay too. But I think those are the three things that folks need to do in order to stay, fully charged or fully engaged. Chief, what did I miss?
Hey, sir, I totally concur. And whether we're talking about airmen, E4 and below, we're talking about capital A airmen, everybody on our team, to including our civilian partners. You said live in the moment, and I think it's important for all of us is to fulfill our role in the team to the best of our abilities. Our time in the service is short, and we should embrace and celebrate every second that we have to serve with our teammates. So absolutely live in the moment, be great at your job. The only thing that I'd add is when you talk about taking care of yourself, not only mentally and physically, but when we talk about educating ourselves and making ourselves better, a lot of times airmen focus on like specific formal education, like what's my next PME or the CSAF or bachelor's or even higher education levels. And what I'd ask you to do is try to educate yourself in a more creative way and study the challenges that we face as a nation, like maybe research China, research Russia, research strategic competition. And so there's a lot of books out there. We were talking earlier today, the 100-Year Marathon is a good one. There's another book called On China. And so there's just a whole lot of literature out there. So I'd ask you not only to educate yourself in those traditional mediums, but also extend your breath in other forms as well. But great job, sir. Hoo-yah.
Awesome answer. Okay. So we do have a follow-up question for the childcare, when you touch on childcare, sir. It's from Facebook viewer Michael. If the Omicron variant continues to spread and the Child Development Center continues to close down, what options will be available for active duty parents for daycare?
Yeah, Michael, that's a great question. It's definitely a concern. I'll go back to the initial thought that I passed to you is for active duty. We're going to be put in a situation where we're going to accommodate you to be able to take care of your child. That's our future. If you're like me, that's likely why you're a part of this. And so if you can't get access to your normal routine childcare, then that's where that conversation has to happen with supervisor, has to happen with first sergeant. Commander has to know about it. That's commander's business. And so that's the guidance that I've given is we're going to accommodate. And so until we can get back open, that's where we're at. And so that means that other teammates, are filling the gap. That means that we've repostured some things, and that's okay because that's the priorities that we have right now. Hopefully that answers it. Over.
Thank you, sir. Okay. Another question here. What do you say to new members at Dyess Air Force Base who feel like there isn't enough to do in Abilene?
So we talk about this at our Jumpstart event. Jumpstart, for those who haven't been to one, it's really a kickoff for when you get to the installation. So you roll into the installation, you see West Texas, you see the big sky in big country. You get checked into your squadron, and then you come. Maybe you're in the Scorpions of the 7th AMXS, and then we're going to bring you to Jumpstart like about a week later. And when you come in at Jumpstart at the hangar center, what you're going to see is you're just going to see all the tables in the back of the hangar center are filled up with folks from our community, are filled up from folks within the installation that are doing activities from outside. And so that's a good spot to latch into. And so if you haven't been to that and you haven't been able to sign up for 1 or 2 or 3 of those groups or events, I'd encourage you to do that. And you don't have to be signed up for Jumpstart just to see the social up front. And by the way, there's refreshments when we do that. So look at the Jumpstart calendar. That's an option to get linked into some things. And then I'd offer, if you missed the Jumpstart tour downtown in Abilene, we're happy to put you back on the blue Steely bus, and we'll do that again. I think downtown, as compared to 2004 when I was here the last time, is incredibly different. There's many more restaurants and places to go. I'd encourage you to look downtown. In downtown Abilene, it's a great place to be. Hey, and then the other thing that we talk about is depending upon where you came from and depending upon what your interests are, West Texas might not be the perfect match for you. That's okay. And I'm going to be completely honest with the audience. I'm from Michigan. West Texas is not 100% congruent with the things that I've experienced in the past, and 100% congruent with my interests. But you know what? I'm going to go try a couple new things. I'm going to see some things while I'm here. I'm also going to work on the things that I can control, that are within my control. And then when I leave this assignment, I'm going to be stronger as a person. I will have experienced a different culture, a different location than I'm used to. And I'm going to look forward to the next best thing. And I bet, 3 to 5 years from now, I'll look back at the sunsets in Texas and say, that was okay. It was a cool team to be a part of. I got to do things there that nobody else could get to do. And in the meantime, I popped over to Dallas, once or twice, or maybe I went to Austin on a long weekend with some friends. I overpaid for food and drinks, and then I came back safely. And that's okay too. And so I'd encourage you to think about all those things. Go to Jumpstart, go downtown, know that, and just acknowledge, hey, this is probably not going to be a location to paint upon where you came from and what you like to do that has everything. No place is. No place has everything. Go visit other spots in this great state. And then when you leave on your follow-on assignment, I think you're going to look back and feel pretty good about your experience.
Hey, sir, if I could add too, we have an awesome Force Support Squadron team here on base. And so a lot of times we look outside the fence line to be able to do some exciting stuff, but I'll tell you, there's some pretty cool stuff happening on base. If you like trivia, we've got Marvel trivia that we're putting on. We have Tahitian dance. We have a Mario Kart tournament at the youth center this weekend. We do seasonal hunts. We do just a variety of great trips. We've got information tickets and tours that can get you over to Dallas to do some exciting things. But I'd encourage you to go to the Facebook site for the Force Support Squadron, and I'm sure PA will help me out by posting that in the link. But that's a great place to be able to find information on the cool stuff that we're doing here on base. And I just foot stomped. The boss talked about the upcoming community needs assessment. If you go out to those web pages and you're not finding what you want to do, that's a great opportunity to be able to tell us what you would be interested in doing, and then we can work to make it happen. Thanks, sir.
No, that's spot on, Colonel Jensen. And then, the other thing that the FSS team is doing, which I think is like frankly outstanding, is if you haven't noticed, there's been one large event per month that the team has put on. And so I've been in, I've been in for over a couple decades now. If you count my commissioning service time, it's close to 3 decades. And I've not been in an installation where there's been a rock concert. That happened at Dyess. And so, there's going to be one big event a month. It is the goal, and it's not even a stretch goal because they're killing it every month. Let's latch onto those when they come and take advantage of it.
Thank you, sir. And thank you, sir. Next question. Are you guys able to tell me anything about the Rapid Airmen Development Program?
Yeah, you bet. That's a unique, and it truly is a unique program. It only happens here. So another example of things that only happen at America's Lift and Strike Base. Started by Major Martin in our staff judge advocate shop. We showed that to Chief Master Sergeant Bass. Not we. He showed it to Chief Master Sergeant Bass when she was out here, and what a great opportunity to showcase his efforts. And so, I'm not going to speak for him in terms of what that program is. What we'll do is we'll get the information out. But what Major Martin does is it's a combination mentoring, it's a combination improvement, it's a combination fitness development, it's camaraderie. And what he does is he brings airmen together in order to improve, and in order to have some camaraderie together. And so there's a series of events that Major Martin has led. Some of them are ruck marches in order to achieve some high standard badges from countries around the world. Other things are just foreign language classes. And so I'd ask you if you're interested in that. That's a great opportunity to get linked into some folks that want to improve. And I give him all the credit. Over.
And Chief Coltrane, you got called out on Facebook. So Hayden said he wants to see you at the next Norwegian Foot March. So just so you know. Next question. Jeremy on Facebook asked, how do you feel about the 7th Maintenance Group winning the Ellis Giant Sword? He's asking for a friend.
I mean, it's incredibly awesome. That's the word. So if you think about how hard that team has had to work to bring the B1 to 95% mission capability rate after not only 1, but 2 fleet stand downs in a short period of time, and then to go head to head with every other bomb wing in the free world and come out on top with a healthy fleet and winning the global strike competition in order to gain that award, simply tremendous. And so my hat's off to them, and super proud to serve alongside them.
Great. We had an airman message us asking, the question is, when will the 3-person dorms be renovated?
Okay, I don't know. We're gonna have to, we'll tag it unless I can get some command team help on this one. We're gonna have to tag that one, and then we'll get back.
Great. And one more question, and it's kind of a similar vein. Is there anything airmen can do to get money from the resilience funds that can help with the renovation efforts for the Soulfire Cafe?
I think what you're referring to, Airman McGuire, is funds for squadrons to use. And so I think if that's the source that's being requested, I think it's unlikely that we can do that. I do know that that's the Soulfire Ministry Cafe is an extension of the chapel team. It's a voluntary thing. It's great. Why I think it's great is because it is voluntary, and it's an environment for airmen to be in, and they've worked hard to do some steps to renovate it. And I know that there's plans with another private organization, the Dyess Care team, to take that a step further. In terms of funding that, I think there's options that are probably better than the resilience funds, and so I'd welcome a discussion about that in terms of what the thoughts are with respect to funding, in terms of the dollar amount that's requested, and then we can probably do a better match than those squadron resilience funds.
Hey, sir, if I may just jump in real quick. First, last 2 questions. Funny, like literally an hour ago, I was in the dorms. So just when it comes to the quads, which is what I think they were talking about earlier with the airmen and the dorms, those were renovated back in 2013. So a lot of our quads are actually in good shape and better infrastructure shape than a lot of other dormitories around the enterprise. So I'd be interested in specifically which rooms need to be looked at, which ones we need to take a hard look at, and maybe we can help those individual airmen out in their particular sections. As far as the brand new dorms where the airmen have their own room, giant closets, and giant laboratories, they're stinking awesome. And they're going to be brand new, and they're going to be available here very shortly. I think we're finishing up with our furniture contract. And so you can expect a lot of our first-term airmen getting some really awesome living conditions for their first permanent duty station. So then break. When we talk about the Soulfire Cafe, that place is fantastic. And the reason why it's fantastic is because it's a place for our airmen to go on our dormitory campus for them to kind of get away from things, hang out with peers. And so we are working with a couple nonprofits off base that have offered to donate some money to basically spruce up the building. However, we are working through a little bit of red tape as far as government facilities, getting donations of that nature. But what I want to tell you is that you have a lot of private organizations on this installation that want to give back and take care of airmen. And so we are looking for ideas and how can we just improve the dormitory campus, right? So do you want Connex boxes with workout equipment to get dropped in the middle of the area? Do you want a brand new volleyball court? What is it that our airmen want on our dormitory campus that we don't need to worry about that specific building because it's a part of whatever? What do you want from us? And you have a lot of people standing by ready to help. And you guys just let me know what you want. And we're excited about taking care of you. If that kind of helps. So let's not don't get focused on Soulfire. There's a lot of other opportunities that we think outside the box, like a fire pit. Man, that'd be cool. Who doesn't like fire pits? And so let us know and let's just get to building.
So if I
Great,
could
sir.
just add on the dorms real quick. So we have been renovating. We've got a whole bunch of dorms that have been renovated. We've got 9 that have been renovated. We've got 3 more that are going to be opening over the course of the next 3 to 4 months. So what I would say is if you're looking at your room and you feel like it's not up to snuff, we need to make sure that gets to the dorm manager so that we can get our civil engineering squadron on it and be able to address the needs that aren't being met. So we want everybody to have a great room and a great place to go back to. So certainly if you have issues, don't suffer in silence. Make sure to get that information over to the Airman dorm leader.
Great, sir. And Chief, kind of going off what you were talking about, Kimberly is asking, is there any plan to reopen the auto hobby shop soon?
Hey, comment is it to Kimberly again, good question, comment question. I'm going to point you to the community needs assessment. So sometimes we'll get this question at the first term Airman Center talk or Airman Leadership School. But those voices are important, but I don't know the totality of the need. And so we need to identify that. I'd ask you to weigh in this quarter and go from there. And then I'll kick it to Chief Coltrane. If I think there's an opportunity to run that program, a program for airmen by airmen. And that's another thing that we're looking at with respect to the auto hobby shop.
Yes, sir. Not much to add besides the fact that if we come up with a unique and hybrid plan in order to give this service back to our airmen, I just look forward to kind of working with the team to make that happen. We hear about the auto hobby shop all the time, and so if we can get there, we will. And if there's a demand for it, then we'll find a way. So community assessment survey number 1, and then we'll come up with a plan to get there.
Okay, Julianne is asking, will Dyess host an air show in 2022?
Good question. In short, we are going to be a part of the Air Fest at Abilene Regional Airport in 2022. We're in coordination through the Military Affairs Committee with the lead of that event. And so that means that we're going to be back on the books to host the air show in 2023. Like all things the last couple of years, things got pushed around because of and as a result of constraints with COVID. And so we're trying to get reset in 23 back here on the installation. And in 2022, another great partnership with the local community. They're gonna host the Air Fest and we're gonna participate, and it's gonna be great. So I'd encourage you. I've looked at the website. It's already up for the Air Fest 2022. Look there, and then we're going to host you on the installation in 23.
Okay, if we don't, I don't see any other questions, so I think we can go ahead and wrap up our Q&A portion. I think we're going to give it over to Chief Coltrane soon, but before we do, are there any additional comments from our leaders? No? Okay. Well then, Chief Master Sergeant Matthew Coltrane, floor is yours.
Hey, once again, it's a pleasure and honor to serve with all of you. For those of you who made it to this time in our broadcast, thanks for sticking around. Hopefully this was of value to you and your families. We look forward to getting information to you in any capacity as best we possibly can. So just remember, you don't have to wait for the next town hall. You don't have to wait for the next survey. If you have anything that's on your mind and you need to talk to your command team, use your chain of command, use the spouse network, use whatever means possible. We don't care how we get the information, as long as we get the information, take care of you. That being said, we're about to go into a holiday weekend, a federal holiday. It's Dr. Martin Luther King Jr.'s birthday that we'll be celebrating this weekend. So I just ask you to take some time and reflect on the man and leadership that we were blessed to have in this nation with Dr. Martin Luther King. I'll share a quote with you it's one of my favorites of all time that Dr. King stated, and that is, the measure of a man is not during times of comfort, but during times of change and controversy. So keep that in your heart as we move forward in 2022. Times will get tough, and that is when our mettle and our grit and our resilience is challenged. And I know that collectively together, we're a tough team. We can handle it, so we can have those fun and happy times that immediately follow. I'll leave you at that, but look forward to serving with you in the future. Over to you, Colonel Kramer.
Hey, Chief, you continue to motivate me. Thanks for joining us. Thanks for being part of the command team, and then thanks to the quality of life team on display here with Colonel Jensen, our mission support group commander, and Colonel Somsel, our med group and military treatment facility lead. Hey, just to the audience, thank you. If we didn't answer your question here and you're watching this on the delay on the video post, come back to our public affairs team and we're going to answer your question. And we'll get you the resources or link you up to a path forward. Again, thanks to the quality of life leadership. Senior Airman McGuire, well done. Back over to you.
Thank you, sir. I appreciate it. Yeah, so this concludes our first town hall of 2022. Thanks to everyone who watched. Thank you for all your questions. And like you said, if you have any remaining questions, just get back to us with those. And everyone have a great weekend. Thank you so much.